Okay. So good afternoon, everyone. On behalf of Faculty of Nursing, Parul University, I extend a warm welcome and heartfelt welcome to all the dignitaries, respected resource person, faculty members, student and participant joining us today for this international webinar. This webinar aims to enhance professional knowledge, promote evidence-based practice, strengthen leadership, and decision-making skills among nursing professionals. We are truly grateful for overwhelming response and high numbers of registration received for this webinar. The first session now starting with international resource person. It is a privilege. It's my privilege to introduce our uh, international resource person, Dr. Trae Stewart, international recognized academicians, researchers, psychiatric mental health nurse practitioner. Dr. Stewart currently serves as a professor of nursing and MHP tracker leaders at the Manchester College of Pharmacy, Health Science, USA. He had a senior academic and advisory role across the United States, Australia, the Middle East, and the other international and conflict-affected regions, contributing to the major USAID funded and global initiatives. His expertise spans mental health nursing, psychopharmacology, service learning, community engagement, and global education. A Fulbright specialist and recipient of multiple prestigious academic and service awards, Dr. Stewart has made significant contribution to research, curriculum development, and international capacity building, particularly in the mental health and public health education. Today, Dr. Stewart will be speaking on the topic of psychiatric nursing myths and evidence-based perspectives. We truly honor to have Dr. Trae Stewart with us and looking forward for the insightful and enriching session. Over to you, Dr. Stewart.
Okay, thank you very much. It's a pleasure to be here. Give me a minute to share my slides with everyone. Are you able to see the full screen of slides? Yes, okay, good. So, thank you very much again. It's a pleasure to be here. When deciding on a topic, I wanted to try to find something that's connected to psychiatric mental health nursing, but that would be very applicable to nurses globally, really, no matter what area of practice that they find themselves in. And this could also be true of nursing faculty, public health practitioners, medical practitioners, so on and so forth. So I felt that it would be good to talk about some of the myths that surround psychiatric nursing and psychiatric patients. So let's start with one of the most common fears. And let me adjust here for a second. So first, let's start with myth number one, right? Psychiatric patients are violent. This is probably one of the most held myths across the globe. And the reason for many nursing students to actually be afraid to engage in psychiatric mental health clinicals or to go into psychiatric nursing themselves. With that said, this is false. Of course, this is a myth. Most psychiatric patients are actually not violent. Only a small proportion of psychiatric patients would engage in violent activities, usually. What we do find is that those who are violent, there's usually something else going on. And there's two predisposing characteristics or practices that help us to identify better those who may become violent. The first is if they're engaged in any substance use. And as you can imagine, if someone is using a substance at the time, then their rational thinking isn't as keen as it should be, right? And a lot of times their brain is kind of reduced to those more primitive, just immediate actions. So individuals who are engaged in substance use, that's one characteristic. Another characteristic, and this is true of all populations, is that if individuals have had prior violence or experience engaged in violence, they are more likely to engage in violence in the future. So if we know that a psychiatric patient has in fact been violent previously, then we should be aware that they may become violent later. However, the majority of the patients who come to psychiatric wards do not have this history. So there shouldn't be anything that makes us believe that they would become violent. And this is where the biggest truth comes out when dispelling this myth, and that is individuals with mental health disorders or with mental illnesses are actually more likely to be victims of violence than perpetrators of violence. Individuals are, the general public, a lot of times may be scared or they don't quite know what the potential is of someone who may be psychotic or is acting very odd, and they think that they have to act out on that person in order to protect themselves. But that is actually not the case. And we also have seen a lot of stories over decades where individuals attack individuals with psychiatric illnesses on public streets, also because they're just easy targets. They're those psychiatric individuals are very scared. They're not necessarily in tune to reality. They don't know how to protect themselves. So a lot of times they're very easy targets for those that harbor some bias against them. So that's myth number one. So myth number two is that mental illness means that you have a weak character or poor will or not a lot of power or poor willpower. So the data shows that this, in fact, is not often the case at all. And this is connected a lot of times to cultural expectations or cultural beliefs. One thing that we have to remember about mental illness in general is that it is a multifactorial disorder. It is a combination of neurobiological, meaning like neurotransmitters, hormones, things that are happening in the body. It's psychological as well as social factors. So we have to take into account when someone comes to us with a mental illness and we're engaging in those initial interviews with them, that in fact, we ask about their upbringing, their education, their home lives. Did they grow up in poverty or what was their nutrition like even growing up, as well as do they have any history of past trauma or violence against them? It's not simply that someone isn't strong enough to fight away some of this, but there's also very sound research and medical rationale for the existence of some of these disorders. Say, for example, schizophrenia, where we know that individuals with schizophrenia have too much dopamine in their systems, which causes a lot of the symptoms and characteristics that we see. Also, we know that schizophrenia has an incredibly strong genetic link across families, and that it's up to something like 80% of likelihood. If one sibling has schizophrenia, the other is going to develop schizophrenia. So it's very much out of the control of many individuals, whether they come to manifest a mental illness. Now, with that said, I also don't want to be naive. We all make bad choices at times, right? And those can certainly create times that may add to a mental illness. or help trigger a mental illness, say, lead us into depression or create anxiety. And that's certainly the case. We can't discount that. However, one um, cause, there typically is not one causal factor for mental illness. So to say that it's just because of weak character or poor willpower is very short-sighted. So we want to dispel that myth. Also, it's a myth that these individuals delay in seeking help. Um, not a lot of the population around the globe is very good about seeking help in general, whether it's cardiac issues, diabetes, cognitive issues, whatever it may be. And those individuals who may be suffering with mental illnesses may also delay in seeking help for a few different reasons. First of all, they don't quite know that it's going on. A lot of mental health can be insidious in terms of how it develops over time. So these very small steps that can make something very large in the end may not be noticed by the individual at the beginning. Okay. The second, probably main reason is mental health remains an incredible taboo across many countries and cultures. So individuals are scared and embarrassed to go and admit that they may need help or they have something wrong going on, particularly with their brain. We see that this is also a gendered issue. Women are more likely to go and seek help, usually twice as likely to go seek help than men. So our kind of gendered behaviors within our cultures also drive some of this, holding back, where men may not see themselves as very powerful or have things under control when their culture tells them that they should be very strong. Okay. In terms of worsening outcomes, a lot of times individuals are blamed for these worsening outcomes when in fact, as mentioned, it's out of their control in its entirety. So let's move on to myth 3. So myth 3 is that mental illness is only spiritual or karmic or even supernatural. Okay, so this is, and I hope that you're seeing the correct slides when I am. Is this true?
Yes.
Okay, you're seeing myth 3?
No.
No,
Two.
you're seeing myth 2. How about now?
Yes.
Myth 3. Okay, apologies for that. And certainly these slides can be shared with you in the end. Okay, so myth 3 is talking specifically about religious or spiritual karmic explanations for mental illness. And this, in fact, is a myth. It is false. Okay, there are, as we were just mentioning, medical, genetic, behavioral, societal reasonings for this. And for many societies in Africa and also in India, this is a very popular myth that many communities hold on to. The issue is that problems can arise when we hold on to these spiritual explanations and they become the only explanation. Okay, so as just mentioned, there are numerous different levels to these mental illnesses. And when we still purport this myth that it's due to karmic or supernatural weaknesses, that is one reason that a lot of people do not seek treatment at first, right? They may go through other avenues to try to address this mental illness when that's actually not the cause of it. And this is one reason that we should engage in integrative approaches. In mental health, we tend to take a biopsychosocial spiritual approach where we take all of these into account when addressing the needs and the symptoms of clients so that we can address all of them simultaneously and get the best care to these individuals. Okay, so myth 4 is that psychiatric patients exaggerate their symptoms. Okay, now Can this happen? Yes, of course. This can happen with any client, right? Someone who goes to see a primary care physician because where they twisted their ankle, they're in a lot of pain. And of course, some may exaggerate that pain. But it also might just mean that each individual feels things much differently than others. So if we just think about pain for an instant, right? I have a pretty high pain threshold, whereas somebody else may not have a very high pain threshold. So they're crying and they're begging for opioids much faster than maybe I would, or even go to the physician to see them. Actually, it might take a while for that to happen. So we have to take into account that each individual and their brain is very different from one another. One thing, though, that many individuals don't know about mental illness is that mental illnesses often come with somatic symptoms, meaning symptoms of the body. So lots of our patients will express pain, discomfort, nausea, tension, stress, muscle cramps, headaches, whatever it may be, even in mental disorders as common as depression and anxiety. And here's, again, they're mentioned here on this slide. And so what we need to do as clinicians and those trying to help these individuals is don't dismiss or underdiagnose something because we don't necessarily think that it's a good match. It simply may be the way that that individual is able to verbalize or present their tension, their anxiety, or their depression to you. So say, for example, someone comes to you and tells you, I'm just tired all the time. Okay, so it might not be simply an issue of them needing to eat more vitamins and minerals or to get rest or to get exercise so they're producing more energy and all of that. That may be the way that their body is initially showing depression. So let's be sure not to write anything off as an exaggeration or something that wouldn't make sense. All right, on to slide myth number 5. If someone is functioning, then they're mentally okay. And this is not true. This is very false. Individuals can still function, especially from what we can see externally, like through jobs or studies, things like that, but still be suffering from a mental disorder. So many mental illnesses are chronic, right? They can last a lifetime. However, we can get individuals to be very stable on medications and in therapy where they can go about daily lives for the most part. Also, just because one is doing well in business and they're, kind of quote unquote able to hold it together through the business hours does not mean that they are not being affected in their home life or outside of the office. Remember, we only see parts of each other's realities. We don't know the full stories here. So please remember that a lot of individuals with mental health issues continue working, studying, and caring for their own family while they're experiencing some of their own mental um, uh, distress, okay? Especially in communities that are collectivistic societies where that feeling of needing to maintain a good outwardly appearance and that you're being part of society and contributing, we find this even more so. And concealment actually can be quite dangerous at times because that leads people to not seek help when they may need it, especially in the early stages. Okay. So moving on to myth 6, suicide happens suddenly without warning. Okay, suicide is a very difficult topic. It's a very sad reality that we have in our societies, no matter where we are. However, the fact that suicide often happens without any warning is a myth. It's not true at all. In fact, there have been qualitative studies conducted on Indian populations that show suicide attempts are usually preceded by prolonged distress or life stressors. And this certainly echoes other research done in other cultural settings. So some of the common warning signs are often indirect. People may seem hopeless. They may feel like or verbalize that they feel like they're a burden to their families or to their jobs or to their friends. We can see them withdrawing from things that typically they've enjoyed doing previously. So those are some of the early warning signs. Even things, especially among kids, say adolescents, they may not be enjoying their favorite foods like they used to. They may be changing their appearance, or they're not as hygienic as they once were. These are all little signs that can add up that show us that something is kind of boiling underneath the surface that we need to address. Probably one of the most important things to share for this particular slide is that a lot of people are worried about asking individuals if they're feeling hopelessness, if they're feeling like harming themselves or having thoughts of suicide, because they think that that's going to trigger something in that individual and then they're going to attempt suicide. That is false. Actually, the evidence shows that asking someone about suicide does not increase their risk of suicide. So if you have grave concerns, especially about a family member or a close friend, please try to find the time to have a private conversation with them and ask them directly if you should be concerned about their safety. Okay, so suicide is a lot of times very preventable when we're paying attention to one another and when we're engaged in one another's lives. It still remains an unfortunate reality that many individuals who are very ill, who are very sick with a mental illness, will find and succeed at suicide many times. But we can do what we can do to help reduce that and to stop it. All right, so myth number 7 is that psychiatric patients don't want help. This is very false. These individuals truly do want help, okay? The evidence tells us, however, that there are so many barriers like stigma, access to qualified professionals, especially among certain populations like rural populations, the cost of getting treatment, and then also being fearful of being labeled once they do seek treatment, like someone in their community sees them going into a psychiatrist's office, for example. These are main reasons for delays. I would argue that psychiatric patients are just screaming for help on the inside. They really, who wants to feel depressed? Who wants to feel anxious? Who wants to feel like they're not in touch with reality? That's a very uncomfortable state to be in. What looks like refusal a lot of times is actually ambivalence for the client. And it's shaped by their past experiences, maybe some of the experience of what their family members have faced, if they had family members that had mental health conditions, and those structural barriers that I mentioned. So again, being open and having conversations, or if you're a clinician and you're working with certain populations, having a short list of where individuals can receive assistance, professional help, if they're interested, just as a resource for them to take, so it doesn't have to necessarily be brought out into the open. Okay. All right. Myth number 8: medication is the only effective psychiatric treatment. This is very false. This is definitely a myth. And I tell my clients this, and I tell my students this all the time. We often feel like someone that has a major mental health disorder benefits from medication and gets better from medication. And a lot of times that is true. However, in my own private practice, I never give a medication only. I always talk to that client about seeking therapy simultaneously. Okay, so for a couple of reasons, and medication does play an important role, right? But we're going to see more consistent outcomes and better outcomes when it's combined with other interventions as well, right? So medication-wise, medications in psychiatry take a while to get stabilized and to come to a steady state in the bloodstream, right, and begin to work. So if someone is started on an antidepressant, it may be 4, 6 weeks before individuals actually can get the benefits from that medication, okay? And someone who is having a lot of sadness, discomfort, and depression, that's too long to wait. Okay, so getting them with a therapist or with a counselor to work through and to begin developing some skills and some management techniques is going to be very smart and fill that window, fill that gap of time. Also, getting them connected to therapy, evidence has shown that it helps them to adhere to the medication regimen itself. So a lot of times individuals will stop taking certain psychiatric medications because it does take too long and they just say, well, this isn't working. I don't, why am I taking this? However, those who are simultaneously engaged in therapy stick on the medications long enough for them actually to come to fruition and give good benefit to their system. The other aspect that we'd like to engage during this gap period of the medication working is engaging the family as much as well. Knowing or creating a good social support system, whether it's family, friends, spouses, children, whatever it may be, can help the individual really be well for a long period of time for that medication to kick in, and it continues past that period of the medication kicking in. So you're really creating an excellent system for them that they can rely on regardless if they're on medication in the future. All right, let's go on to myth 9. Psychiatric patients cannot make decisions. So capacity is what we're talking about here. And capacity is often misunderstood. And that's why this is a myth. It's false. Okay. A psychiatric diagnosis does not automatically remove an individual's decision-making ability. Capacity depends really on someone's understanding, their reasoning, and their communication for a specific decision. Individuals, and this differs by culture, legal systems, and countries. So, and of course, I'm bringing a United States lens to this. So apologies if it differs from where you are. But for someone to be ruled that they do not have decision-making capacity, we have to find that they are unable to care for themselves, that they're a safety hazard to themselves, or a safety hazard to someone else, or they simply cannot understand the processes of, say, the court system or the hospital care system itself. Then we need someone else to be able to make those decisions for them. And usually while they're in the hospital, that means that it's the physicians and the nurses and their treatment team that's doing that for them, often in alignment with their family. Okay, that's maybe acting as a medical power of attorney, unless they give the hospital that right. In India, Indian law does explicitly support autonomy and supported decision-making. So India is very strongly in favor of letting clients, including psychiatric patients, maintain their autonomy and decision-making ability as long as they can. And for most psychiatric clients, that's always. It's only when someone has very acute, chronic, destabilizing mental illness that lasts for years that usually are exceptions to this rule. All right, and moving on to myth 10, to be cognizant of time and to leave plenty of time for my colleague, Dr. Suresh, to share his brilliance with you. We move on to the last one, which is psychiatric patients are fundamentally different than other patients. So as you know, all of these are myths, all of these are false. And the fact of the matter is that psychiatric patients are not really different than other patients. Anxiety, depression, delirium, trauma responses, substance withdrawal, these appear across every nursing specialty. When I talk with my students about, what area of nursing do you want to go into? And then I'm like, okay, what about psychiatric nursing? And they're like, oh, no, 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 no. I'm like, well, guess what? You're going into psychiatric nursing regardless, because mental health is in every aspect of health. You cannot separate the two. And in fact, most acute issues of mental health are seen in emergency rooms, not on psychiatric wards. If you're going into geriatrics, you're going to have a lot of mental health issues to be concerned with. So everyone should be very cognizant about the mental health needs, disorders, and treatments, because they're going to see them. So in short and in conclusion, psychiatric nursing is not a niche skill, okay? It is really foundational nursing. And that's where I'd like to leave you. And at this time, I think we might have a little time for some question and answer. So I'm going to stop sharing my screen. And then please, if you will, I think we might want folks to type their questions. Yes. Into the chat area, and then I can see them as you respond.
So participant have any questions, they can ask to sir or they can write in chat box also.
And certainly, I've shared with Ms. Steffi that these slides are available. So they can be shared with anyone who has signed up for the webinar. So that information is yours. Feel free to use it. Feel free to share all of that good stuff. Let's see.
You can write in chat box. Yeah.
Yeah. The scope of nurse practitioners in psychiatric nurse practitioners in India. So my understanding is, I was actually looking at this last week. My understanding is that the nurse practitioner role, it does not quite yet exist in India. I think it's probably coming, just because we don't have enough clinicians or providers to meet the needs of all of our patients, regardless, psychiatric, medical, OBGYN, all of that. So I think that's coming. And what we've seen in other countries is when the nurse practitioner role comes to fruition, becomes legal, psychiatry is usually one of the first areas that gets developed, because there are so few mental health providers available. And mental health is in every aspect of health. So I'm gonna keep my eye on it. I hope it happens. And, India would be a great place for the role of a nurse practitioner.
Thank you, Mr. Jagdish. Any other questions we have? You can write in chat box. Yeah.
Okay, well, feel free to add any additional questions if they pop up as you listen to Dr. Suresh. But with that, I'm going to say Dhanyavad and Namaste to everyone for joining today. And I'll turn it over to the brilliant Dr. Suresh.
So thank you, Dr. Trae Stewart, for an excellent and insightful session. Your presentation on psychiatric nursing myths and evidence-based perspectives was highly informative. and truly enriching. On behalf of Faculty of Nursing, Parul University, we sincerely appreciate your valuable time and contribution, sir. Thank you once again. So moving towards the second session. Sir, you can stop sharing your slides so I can share.
I'm still sharing.
Yeah.
I don't think so.
Fine. Yes.
Yes, you're sharing. No problem.
So it is my great privilege and honor to introduce our second distinguished international resource person, Dr. Suresh Babu Naidu Krishna. Dr. Suresh Babu Naidu Krishna is highly accomplished academician and researcher, scientist with over 17 years of rich experience in field of biotechnology, nanotechnology, and applied microbiology. He is currently serving as a research fellow at Durban University of Technology, South Africa, where he has been spearheading the impactful research focused on nanotechnology and its implications on health science. With over more than 72 publications in high impact peer reviewed journals and contribution to 20 book chapters, Dr. Krishna has made significant contribution to enhancing scientific knowledge, and he has also inspiring mentor, having guided students across the bachelor's, master's, MPhil, and PhD level, and has actively collaborated with the policymaker and the practitioners to translate research into the practice and support curriculum innovations. In recognition of his excellence, he has received several institutional and national awards, including Faculty Researchers of the Year and highest cited author, further affirming his influence in the global research community. With his strong academic foundation, international exposure, and passion for innovations and healthcare science, we are truly fortunate to have him with today. On behalf of Faculty of Nursing, Parul University, I warmly welcome Dr. Suresh Babu Naidu Krishna and invite him to share his valuable insight with us. Thank you, sir, and hand it over to you.
Good afternoon. I would like to thank Dr. Steffi Abraham for introducing me to the elite audience of Parul University community. And I would like to thank Dr. Trae to resolving our myths surrounding sacred patients. So I'm really opened up my mind towards the sacred patients from today because those myths are broken now. Now, I would like to share my slides in few seconds and just confirm me the audience is audio is okay and the slides are visible. Right now, I'm sharing few seconds. Thank you. Hi. Can you please confirm that the slides are visible and my audio is okay?
Yes, sir. Yes, sir. It is visible.
Thank you very much.
Yeah.
So myself, in short, referred as Dr. Suresh Naidu, and with the ORC ID number I'm displaying and the contact email. Today's topic will be innovating healthcare through market analysis, lessons for nursing leadership. The idea behind taking this topic is generally we teach nursing students what to do in the research or in their subject specialty and how to behave and everything. But often they end with the jobs which are meant for only for nursing. That is nothing but as caregivers. So to break this trend, I thought we should also give thought provoking or innovating ideas so that even nurses can become market leaders and especially in the business sector through their innovative ideas. That is the reason behind selecting this topic. I will go through the some of the steps how to go through this nursing leadership and what you can do best because I'm teaching now BSc 7th SEM and Masters in nursing. But I know that this audience for this webinar covers wider group, and someone can take some message from here so that if they become a innovator or a leader, I will be very happy. Thank you. So now let us look at the careers which are available for nurses. A registered nurse can grow up to nurse manager, or she can go for in an online this thing where they may get recognition as nurse informatics analyst, or they can go for telehealth nurse. Some with their passion in research, they can go into clinical trials and end up with research nurse. And some out of their passion, they can go into academics as a nurse educator, or they can go into administration side in a big hospital setups like corporates or Apollo Hospital, something like, and they can become nurse administrator, superintendent nurse, something like in the high scale, and you can also become public health nurse. So these are some of the best careers which are available for nurse at this stage of time. The intention is apart from this you can do lot to grow yourself and establish yourself as a entrepreneur in healthcare sector. Just for the motivation, here I am showing our ex DVC, Prof. Naktula Sibia. She is a professional nurse. The Department of Nursing in DUT was established by Prof. Sibia, now heading other institute like based in Durban, Mangasuthu University of Technology, and she is vice chancellor. So in academics also there is very good scope for you to become vice chancellor, and this is the best example where you can aim if you are in education sector. Now, when you look at the healthcare landscape, this is evolving very rapidly, where you need innovation to meet new demands and competitive pressures. So these are all treated as global healthcare challenges, which often come with rising costs, aging populations, and digital disruption. In the sense, digitalization of this process is very much novice and it is happening now. So what are all the some of the factors which influence this global healthcare challenges are there is a lot of technological advancements. The nurses who are 10 to 15 years back were challenged, but now it is not the same case. The intervention of AI and all other factors, digital, you have a lot of technological advancements. And also, with the livelihood increase, the cost of living as you are paid more, the expectations from patients are also more in corporate hospitals, in district health hospitals, or public sector hospitals where you go. There is a lot of expectations from patients from nurses. Given the number what here in India is encountered is more than what generally a public hospital in Durban issues. So they meet the expectations of the patients. And now, apart from this, you have competitive market entry by non-traditional companies. Means, if you take Cipla or if you take Pfizer, they are traditional companies which are playing very important role in the drug manufacturing and everything. But you have traditional companies which are already existing in the uh, landscape, so that they also play very important role for these global challenges. So, and there is ultimately ongoing staffing challenges and burnout issues among the nurses because they are little bit overwhelmed with the jobs or work time shifts, and this will definitely lead to imbalance, and ultimately mental health issues will start when you are under too much pressure at the workplace. So just in this slide, the forthcoming, I will tell you how non-traditional companies are entering into market and how they disrupt the piece which is already existing. Now you see these are the some key trends which are happening. If you look at Allen Laboratories Limited on their website, they give that they are available and their products meet each and every health related issues. So this is totally non-traditional company which is making its benchmark in the healthcare sector. And now with the use of AI utilization and data utilization, you are going to have diagnostics, personalized treatment plans, and administrative efficiency. So if you see here, this one is having ECG in hand. So nothing is not required here. And if you see this picture, it is used AI based, used for the treatment of walking in Parkinson patients. Okay, this is one company which is already set foot in the Indian market. And now the instrument here which is shown is for cancer detection. So they came with the innovative idea. They can detect the using nanotechnology. They want to detect the whole cancer area, which was not available partly after before 5 years, something like that. So now there is lot of market penetration and there is lot of technological advancements, and non-traditional companies are penetrating into the market. So with all this, sometimes nurses may think that their job may be under threat. Hope it will not happen like that as such, but it takes time. But some progress has been made where you have to think strategically to improve your careers and to establish yourself in this competitive market. So we are focusing on today the nursing students especially and nursing profession in particular, what you can do best to keep up with the market trends, and how to if you are going to start a new company, what are the tools you have to use, and what are the best options you are going to have in front of you when you take up that decision to act as an entrepreneur and set foot in the healthcare sector. So for going towards that, first thing what they say, you need to have market analysis. So market analysis, when we do, it involves gathering data from diverse sources to gain holistic view of environment. Means the market environment. This is generally given to third parties for doing a survey. What is the market? Suppose if you want to introduce a new drug, or if you are a third party seller of a new drug, or if you have a innovative idea and you want to develop like ECG I have shown, no? You want to come with another device with more accuracy. How to enter the present market is you need to do some market analysis in support of this. So generally for nurses, patients are best resource persons to get the feedback. So always take feedback from patients and staff who work in the hospital, and discuss with them. No need to disclose what you are going to do tomorrow, but you need to discuss in brief, giving no clue what you are going to launch, and you can ask them what is the perception of this market, and what do they think, and how they can guide us. So, like that, you have to have an initiation to get the market analysis, and you should also check about the vendors who are already all over in the healthcare market, and who is the payer for them, and what are the government sources they are exporting presently to get benefits. And always focus on local market trends than global trends. Global trend will give you a footprint which is already established, but local market will be different because the competition is different in local markets. Okay, that is very important. And you need to have a clear idea on finance and operations data. Most nurses, as are healthcare professionals, we are acquainted with the normal everyday job life, going to hospitals or doing our shifts, completing and coming back, and mingling with family and everything. So finance and operations data, we are not familiar. So you need to familiarize yourself or hire a expert who is into a consulting business, so that he can give you exact finance and operations, how you can achieve your dream job or dream company if you want to establish. So generally, this, if you acquire all this data, it helps you to identify specific problems and potential solutions for this existing problem, and guiding where innovation is most needed. So you need to have this background information when you start any new company or new product launch something. You need to do market analysis. So when we start market analysis, any consultant will always tell you what is your customer. We speak as an audience, but in technical terms it is called as customer. So there is a quick word, customer discovery, which often consultants use. So how you will get your customer know-how? So this customer discovery and market analysis always will have impactful innovations. So you need to have essential impactful innovations to reach your customer discovery. So always you should focus on the gap which is available in the market, so that you can meet those demands. So this will come from translation research from lab to market. So you need to identify the gap which is existing and take your product there. And always you need to have fundable business cases, means you should have a strong foundation for fundable business cases. So we need to acquire data driven evidence for investors. So investors will not just invest in your company when you go with proposal. That is not happening with the banks also, because you need to have a report to be submitted for the banks or investors with a detailed executive report, so that they read each and every factor and they're happy, and then they will start thinking funding your project or your dream, whatever maybe you want to do. Or you need to have a demonstration of market need, that is, which is, we call it as a core requirement for the Parul University program. If you take, you need to establish initial evidence and general conversations with potential end users. So who are end users? You need to have a thorough knowledge, and you need to approach them. What are their opinions if you launch this product? And always you need to depend on stronger evidence by systematic validation. Systematic validation is, you need to have a case report, understand the case report, and when you study a case report, there are several companies which are open for 1 year, 2 year, and they are exhausted and they are not in the market now. So if you study those reports, why they are not surviving, it will also give you an idea what you can do best in such cases. Now, why market analysis is crucial for your innovations, especially with the nurse profession. Market analysis will teach you strategic benefits, which you can look and it will always help you to pinpoint unmet needs or gaps which are existing. It also estimates revenue and scale, at which scale you want to work, at which revenue point you have to stop. You cannot go over investment in your product. That will be identified by market analysis. It also informs strategies, that is nothing but guides product development, pricing, market entry, all those points. And when you have a very good report, it attracts investment also. So it provides evidence of market viability also. Now, viability is uh, how much you can invest and how much you can gain, is nothing but market viability. And it also teaches you, mitigates high risk factors, means it highlights challenges, who are your competitors and what are your hurdles, are nothing but backfires when you start a new product in the market. This is done by market analysis only, where textbooks will not teach you about this aspect, except the management science students will be taught these points when they do specialties. So let us see what are the components of market analysis. So for any industry overview, always if you want to start a new industry, you need to have a scope. You need to analyze current trends, growth rate, and what are the key drivers using tools like Porter's five forces and test cell analysis. I will explain in the next slide what are these. You need to identify target markets, TAM, SAM, and SOM. So TAM is nothing but total share, what you get in a market. SAM is actual share you have and you can contribute in the market. SOM is particularly what you can contribute. Means if you take 100% market share, your share will be only 10% because already there are existing com- competitors. So segment customers by demographics or psychographics, behavior or firmographics can be achieved for identification. Customers' needs and pain points need to be understood. So to do this, you need to hire a person or a consultant who can do surveys for you, interviews for you, yeah, online reviews can be done, and forums to identify jobs to be done can be established by third-party service providers. And you need to have competitive analysis, especially direct and indirect emerging competitors need to be identified if you are launching any new product, or if you want to establish a new hospital also, you need to have this one. And you need to perform SWOT analysis and understand what is your strategic positioning in the current market. And you need to understand what is the market size and what are the trends. Estimate market value using reliable sources and identify macro trends which generally are followed in commercialization. Apart from this, when you want to launch a product, you need to understand the landscape of regulatory issues. Means when you want to start a new product, all the regulatory clearance should be issued before you start or launch a product. And economic environment, you need to understand what are the legal barriers and what are the economic indicators for the launch of this particular product. And let us understand what are the tools and frameworks which are very essential when we start market analysis for any profession. So you have Porter's five forces which analyze the industry competitiveness, SWOT analysis. I will explain what is SWOT, and it will give you internal and external environment, means what are the strength, what is the weakness, and what are the opportunities and what are threats when you start any new venture. That is the full form of SWOT, and it will give you that environment. And there is another tool which we call it as PESTEL, which will evaluate macro environments. TAM, SAM, and SOM, where they determine the market size of your interest. And there is ANSOF matrix, which explore growth strategies for your product, and there is BCG matrix which analyze product portfolio. Now, if you look at these five forces, that is Porter's five forces, it will help you what are the bargaining prices. In the sense, you need to understand threat of a new entrance. They will give clear picture, threat of substitutes which are already existing in the market. You will also understand bargaining power of buyers, whether they are expecting drug at low cost or high cost, and the quality, bargaining power of suppliers, and who are your regular suppliers you have to identify, and you need to identify rivalry among existing competitors. So generally, when you give instructions to a marketing company, they work on these five forces or five tools very essential regarding your product launch. And they will do surveys, they do interviews, they go to your competitors, they discuss, and they get information for you because it is paid service. So in SWOT, as I said, we will check at strengths, we will check at weaknesses, and we will check at opportunities, or we will check at threats which are already existing in the marketing. So if you look at healthcare sector, what are the SWOT factors which influence? Strengths will be, you will be having a lot of skilled workforce, and you will be having patient trust. For a nurse point of view, I'm telling. And weaknesses will be, always there will be staff shortages. And if there is a staff already there, burnout means they are already preoccupied with lot of work and they are exhausted. And what are good opportunities for nurse team depend to explore the healthcare sector? One of the best now online digital health has taught us is telehealth, which will open new avenues for nurse if you take AI introduction also, and preventive care medicine. Okay, so these are all the two big opportunities what I can see in future and presently. And threats will be, there will be constant policy changes from the governments. You need to follow up the policy changes, and you need to understand the competition, means which market you are going to enter. A private person cannot enter vaccine market because they cannot meet the demand what is required by Indian setup or any other country setup. So you need only public sector companies to deal with such technologies, but you can see other areas where you can contribute directly to the to meet your dreams. Now, there is another tool in market analysis which we call it as PESTLE. In short, it is special analysis. So I will explain how we can understand DUT and Parul University nexus through research collaboration. So if you write any good IP related project, always align these projects and bilateral higher education priorities, engage institutional leaderships and diplomatic channels to secure approvals and support. So sometimes when we write big projects, you need to have some alignment with higher education sectors. So you need to have that connection, either it may be political or non-political. You need to have a overlook at this one. And economic aspects also, you always leverage on joint funding opportunities and cost sharing basis. Design projects with clear value propositions for funders and stakeholders. This is a case I'm telling between DUT and Parul University. And social factors, you have to take into consideration of co-create research that addresses community health and workforce needs. So you need to take into social activities also. Technological, so prioritize interoperable digital platforms for data sharing. So this is one aspect we need to look strongly about data sharing and remote collaborations, which is always encouraged, and invest in training for research tools and tele research methods. So this is one area where we can take it up. And Legal. So if you have any legal concerns, establish clear IP cells at the respective institutes who can deal with the IP related issues, and you need to have data protection policy and ethics review board of both the institute should be in existing conditions so that you get ethics clearance for projects easily. And environmental. So if there is any environmental issues, the projects what we take care, you need to integrate here so that these tools are very much essential when we write any joint collaboration projects. So the take home message for here, this slide will be nursing leadership role will be anticipating external shifts. So you need to change your perspectives on jobs so that you are ready for embracing the new environment. That is next steps in your life. This is BCG, Boston Consulting Group matrix. So they say by four factors like SWOT, they have stars and question marks, cash cow, and dot. So the market growth versus market share is always explained. For stars, it will be high market growth and high market share. For question marks, market growth is high and market share is low. When they speak of technical term cash cow, you will be having market growth low but market share high. And if you speak of docs term, it is always low with respect to market growth and market share. These are some technical terms which are used in business language, especially when they do market analysis. The report what they send you will have all these outputs like pestle analysis, Porter's analysis, SWOT analysis on the project which you are taking so that they will give projections for 5 years. If you ask for 5 years, they will provide 5 years, or if you ask for 10 years, they will provide for 10 years market value. So I was stressing about Porter's five forces, which is the strategic framework developed by Michael Porter in 1979. It will explore industry's competitive nature, attractiveness, and profitability. Always, it will explain bargaining power of patients, bargaining power of suppliers, threat of new entrants, and threat of substitutes, which are already existing in the market. So, nursing leaders must see themselves in this competitive landscape if you want to have your own business venture in future. So, you need to understand all these factors when you want to go for new ventures in your life. And the global context is changing very rapidly with the intervention of robots and AI intervention, which you can sense already the lot of work style change in some developer countries. And very soon, India will also pick up the trend because Japan is experiencing this. And now, the customer discovery in healthcare, always we say patients as customer. So you need to discuss whatever you want to have and treat patients as your primary customers. So patients express a lot of unbiased this thing as a customers. They may say very, if they are not happy with the administration, they will say that particular admin is not treating me well. And if a nurse is rude, they will tell nurse is rude. If physician is too good for them, they will worship and fold hands and they appreciate his work. So this is happening in everyday setup. And a healthcare expert should also see the techniques which are happening around them. So to understand this, you need to have interviews, surveys, and observations, which needs to be done constantly for the product launch. Some of the examples what I can quote is chronic care needs beyond symptoms. So apart from analyzing the symptoms what they have, you need to think beyond that if there is any chronic necessity for your patients. So always the message is structured discovery reveals hidden patient needs. You need to have a structural approach like this so that the patients themselves will tell you what they need. So if you see that in the existing hospital setup, you don't find all these factors what a patient has expressed, then that is the opportunity for you to establish yourself by providing another service provide means nearby and establishing yourself. So what I mean to say is this is not going to happen in one day. So you need to plan and execute properly at appropriate time so that you can also become market leader like others. But your perspective that nurses or caregivers should be overcome or wiped off and take advantages as it comes. So I will explain the case study of telehealth adoption by nurses. So telehealth adoption by nurses accelerated by COVID pandemic, which was very vital and had a lasting component of care, allowing for remote monitoring, education, and consultation. All these were not there in 2019 and above. In the sense, when you go back 2019 and everything, these conditions were not prevailing. Only after COVID outbreak, these came into picture, and we are now more acquainted with remote working. And we like remote working only. And even though institutes or workplace calls them to come to workplace, we are not ready to take it as a challenge because we are more acquainted with the relaxed lifestyle that is nothing but remote working. So even though they say that 90% of nursing students use digital tools, actual adoption among registered nurses is only 22%. So it is primarily utilized for chronic disease management and reducing hospital readmissions and increasing access in rural areas. So digital or telehealth intervention is there for these case studies only. And when you think of SWOT of telehealth adoption by nurses, strength will be you are having very good clinical expertise applied to virtual care. So when a nurse is selected for telehealth company, you are having these strengths which are already uh, inbuilt in you by your work experience. And trust and rapport with patients is already established. And what are the weakness? You see, when we go for this shift in online digital monitoring and everything, they need to have a proper training. That is, initial training and technology barriers should be overcome. So a nurse should be very much use and comfort in the use of electronic devices. Sometimes nurses with age they lose the touch of reading in the sense technological innovation they're not tech savvy. So if you are tech savvy you are good. If you are not tech savvy then there will be some barriers which you need to overcome or you need to attend training programs. You need to attend capacity building programs in AI use at workplace and how to go through EHR reports. All these things are countered by especially nurses. I don't know about the nurses in Indian setup, but in South Africa we hear some in conferences and everything that these are the complaints what they generally experience with nurses who are little bit above age group in the sense above 50 and everything. They are comfort in giving the care to patients, but they are not tech savvy like youngsters like you. So these are the weaknesses when they take up telehealth adoption and opportunities are more. So you will be having expanded access to care for patients and potential for role of expansion and leadership will be opened up when you take up digital intervention. And threats will be you will be having a lot of policies change which are governed by change in shifts or working time or salaries. These are all the threats which you may anticipate. And data privacy and security concerns are already existing. So it is not likely to fully overtake, but human intervention will be there even for digital penetration. And this slide explains what are the key areas for strengthening nurse, especially the workforce should be highly motivated or you should increase the workforce. The leadership qualities among the nurses should be high, and education and adding additional certificates is required, and well-being of nurse, that is not overwhelmed with work pressure, that is the well-being, and emergency preparedness and response to any emergencies should be aware by nursing roles. So how this will have an impact on health, both in medical and social setup? You will be having structural and individual development, which will have, once you inculcate these habits in nursing roles, you will be having both structural and individual development, which is governed by payment laws, policies, and regulations. So you will be coming to health equity and healthcare equity, which is nothing but SDG goal 3, One Health. Okay. So this is also governed by evolving trends like demographics, technology, care models, public health emergencies, and attitudes towards racism and equity. So when you want to achieve all these major goals, innovation is the one word where you need to have new ways of delivering care. So, not a traditional care, there should be innovation in your approach for this process. So, in this innovation era, current industry standards, if you go through the document Future of Nursing, meant for 2020 to 2030 report, highlights essential skills for nurses, or if you want to become leaders in the healthcare sector, you should inculcate divergent thinking, the ability to move away from linear solutions to explore multiple unrelated creative possibilities. You should start exploring divergent thinking. You should embrace yourself with digital literacy and AI adoption at workplace. And leaders must now navigate the ethical integration of artificial intelligence in diagnostics, predictive staffing, and virtual nursing models. These are all anticipated and it is recommended in the policy document. And design thinking, utilizing human-centered process, that is empathy, ideation, prototyping, and testing to solve complex and clinical problems should be more centered towards human approach. And you should have a good foresight in the leadership, using structured and futures methods to anticipate industry disruptions rather than merely reacting to them. So you should anticipate what can happen in 5 years, in 10 years, and you should have an action plan for that if something happens. Like COVID taught us a lot of change in our lifestyles. So another pandemic or something hits, you should have a preparedness. So that is what happening across the globe now. The world, the countries which cannot synthesize or manufacture the vaccines, now they are start investing on that particular aspect. Their CSR is focusing now more efficient ways to synthesize the vaccines, because African countries were denied access to vaccines in the initial stage when there was COVID breakdown. So they have gone through all those tough time and lost. We lost a lot of many dignitaries in the colleagues' form or friends, families. So this is what it has been thought, and the government has taken strict steps, and budget is allocated to encourage youngsters to take up this manufacturing unit sector as one of the goals. So in CSR, we have programs where good manufacturing practices are taught, and there are special programs on vaccine related area. You can explore the website CSR South Africa, and government of India is also doing a lot of programs to inculcate this habit in youngsters. And especially being nurse, you should see what you can do best if you enter that biomanufacturing area. And always, as I said, robots intervention is already there, and there are different types of robots, and I focus on care robots. So the number of robots used to provide care and support to elderly and disabled patients is currently very low when we take whole image, but it has been significantly increased in the Japan, which is facing a predicted shortfall in the number of available caregivers. So their caregivers are in shortage, and they have already introduced robots in the uh, normal life. So caregivers are already in place, the robots. So what are the cases if robots are in healthcare? So the first robots in healthcare was introduced in 2019, as per literature what I have gone through. So especially this happened in China, where they use a stimulation device in brain to inculcate in the Parkinson's patient located nearly 1,900 miles away in Beijing. So that is the feat they have done by using 5G technology. So they are doing, and most of the hospitals, what I have seen some videos and everything, robots are actually involved in like nurses, what generally we do in the hospital setups, and we have surgery robots, and remote surgeries are also operated, and micro robot assisted disease detection treatment is on the way, and minimal invasive surgery is already done, and orthopedic surgery is also done. And this is not something new, but I wanted to show to students that this is already happening, and India has also embraced certain hospitals robotic surgeries are done, and especially in Apollo hospitals, in some elite points, it is executed also. Just have a look at this news bite.
The sound is not there.
Okay, I'll skip this. Yeah. Sorry, guys, because the audio is not coming through the video due to some technical glitch in the laptop. So there in that video, I will share the link with the department so that you can have a look, and you can check in the YouTube also, that is available. Uh, the robots are in place in hospital setups where they are actually participating, and they assist nurses also in taking tools from one floor to another floor, something like that. They carry heavy instruments, and I have seen CSI Durgapur has also developed a tool, robo, like assistive robo, which can carry up to 10 kgs, 100 kgs stuff from one floor to another floor. It is also on the demo in YouTube. You can check it out. So these are all happening in nursing field, especially in healthcare sector. So nurses are no more caregivers. What I believe is nurses are system shapers. The take home message for today will be, you need to have a business perspective in your course, what you are undertaking. Don't think that you will end up in hospitals. Don't think that you will end up in clinical trials. Don't think that you will end up in academic sectors. Keeping all this as a safe betting, go for business entrepreneurial aspects also. So who knows? You may employ 100 employees in future soon after starting a company in more than 10 years. So that is big than working under someone. So you need to think out of the box. That is the take home message for all nursing professions. And always nursing leadership requires strategic thinking well in advance, because health sector is one thing where there are dynamic changes. So the technology which is today will be not, or will be outdated soon. So you need to have that innovation thinking, and innovation is essential in your journey towards life. I would like to thank the management, the staff of Parul University, especially nursing department, and colleagues who are assisting me in sharing my knowledge here today, the IT team. I would like to thank Parul team and our DUT for giving me this opportunity to present myself in this international program. So if there are any queries, you can drop me email at sureshk@dut.ac.za. I will be happy to answer. Or my email is shared with staff. You can collect. Okay. Thank you.
Thank you, Dr. Suresh Babu Naidu Krishna sir, for insightful and enriching session for innovating healthcare through market analysis, lesson for nursing leadership. Your presentation offer valuable perspectives on innovation, strategic thinking, and leadership in healthcare, which will greatly beneficial for the nursing professional and our leaders. On behalf of Faculty of Nursing, Parul University, we sincerely appreciate your valuable time and contribution, sir. Thank you once again. If participants have any kind of questions, they can write in chat box. We are open for discussion.
Thank you. Yeah, you can write on the chat box so that we can take it up and we can answer.
Sir, we have one question from Dr. Abhay Patan, sir. Can robotic take job of nursing professionals?
No, it may look very fancy. Robotics will assist, but cannot take the position of nurse because nurses show lot of emotions to the patients. That is nothing but empathy, personal rapport, taking care. But robots are fed with certain tasks. If they say or if they are programmed to deliver the medicines to room number 101, they will go and keep at the destination only. They won't talk to patients. How are you? What are you doing? How are you feeling today? This is expressed only by human subjects, not by robotics. But robotics are assisting, that's all. But they cannot take full position of nurses. But to control those robotics also, you need a nurse. Okay, one who understands this work ethics at hospital setup. So they are programmed to deliver tasks, but they are not programmed fully to intermingle with the human subjects. So I can see the clear limitation, but it may assist. It may look very good if someone carries your work related things from first floor to second floor. That is okay, but they cannot interact with the patients. I can't see that future, even though Japan is a special case because most of the population are superannuated, means they are very old now and they are in need of the nurse. But Japan, by innovation, they take up different jobs. They are not coming to this profession. So there is a shortage, and they are managing by introducing robots at hotels and old setups, something like that. But in our cases, generally, they cannot replace human beings. They may enter certain platforms only, not fully. Thank you.
Thank you, sir. Any other questions we have?
Ma'am, they can post on this chat box. If they post late also, we can pick it up and we can answer them
Sure,
because
sir.
they are our audience. We can pick it up.
Sure, sir.
Can
Yeah.
take your link in
Yeah.
this program.
Is the PPT is visible, sir, on a screen?
Yes. The
Yes, sir.
market slide. Out of juice.
One second. Okay, as we come to the end of today's international webinar, I would like to express my sincere gratitude to our esteemed resource person for their valuable time, expertise, and the inspiring sessions. Their insights have truly enriched our understanding and strengthened our professional perspectives in nursing and healthcare. I also extend my heartfelt thanks to all the participants for the enthusiastic participation and active engagement which made this webinar a great success. I would like to express our sincere gratitude to Dr. Ravindra H.N., Dean, Principal, Faculty of Nursing, Paru University, for his valuable guidance and continued support. We are equally grateful for the opportunity and concerned support provided by Dr. Preeti Nair, Director, CRR, Center of International Relations and Research, Paru, and his team, Paru University, Vadodara, Gujarat, which made this international webinar possible. On behalf of Faculty of Nursing, Paru University, thank you all for joining us today. We hope the knowledge gain will positively influence your academic and professional practice. Wish you all continue learning and success. Thank you all. Have a great day. Thank you so much.
Thank you.
Thank you, sir.